Public Health England reports an anthrax outbreak amongst heroin drug users in Manchester. They have called for a public press conference. We take you to the live action of press conference at Public Health England.
Good morning, ladies and gentlemen. I'm here on behalf of the Public Health England to address the public and answer their questions in regards to the anthrax threat that's come out in the media. There is an ongoing sporadic cases of anthrax among heroin drug users in Manchester. We've had so far 8 cases. The first case was on the 27th of April, followed by another case in 24 hours and another one in 36 hours. Unfortunately, the first case has died. Now, till this time, we have 5 new cases. We have dealt efficiently from the day that the anthrax case was confirmed. We have taken the required measurements to contain and control this case of anthrax in the Manchester area. I'm here to assure the public that we are taking every measure to protect it from these cases of anthrax. And I will start taking questions now. Yes?
Have we found out how people are getting sick? And is it just the Manchester area or is it spread?
Well, it seems to be that the cause of this anthrax illness is caused by a contaminated sample of heroin that's in the streets. And the cases so far are among the intravenous drug users, and they are obviously using the contaminated, or what you think they're using the contaminated heroin that led to their illness. And sorry, the second part of the question, I've missed that.
Is it just in Manchester or is it spread?
Yes, so far it's in Manchester. We are collaborating with our partners in Public Health England to see if there's any cases elsewhere, but till now we don't have any data that tells us it's anywhere else. Yes?
Is the whole population at risk of contracting the disease?
It isn't. The whole population isn't. It's only, if I could say, a small number that are at risk. Basically, they are the people who will come in contact with the contaminated heroin. So, for instance, like the police force, if they sort of handle any contaminated heroin, they can inhale the spores of the anthrax bacteria, and it will sort of affect them. Also, the healthcare workers, doctors, nurses, lab workers, if they come in contact with this substance, they can be affected or infected, actually. Yes?
Have you done any preventive measures to control this outbreak?
Yes, from the day that the case was confirmed, we set an emergency response team, which took the necessary measures, where we have informed to start with the main population at risk, which are the intravenous drug users. So we spoke to MASH, which is the Manchester Action of Street Health, which runs the centres, the needle exchange centres. We have informed them and supplied them with leaflets and other ways of information to provide to their customers or clients, you know, the people who use the needle exchange service. We also informed the police force of the existence of the possible contaminated heroin in the streets. We also spoke to the A&E departments in the Manchester area to be aware of any cases that would come through with the anthrax infection. And that's it basically. Any other questions? Yes?
Do you think this could be deliberate? Could it be possibly bioterrorism?
So far, there's no data that supports this sort of situation. The cases seem to be confined only in people who are using drugs intravenously. To this moment, I do not think that it could be a bioterrorist act.
Thank you.
Any other questions? Yeah.
Have you been able to trace back the source of infection?
Unfortunately, we haven't traced the source so far.
And what about the evidence? That have you got any evidence from the police department
Just recently we have managed to get our hands on a sample of heroin that was seized by the police force, and it has been sent to the lab. But till this moment, we haven't got any results. But we will keep you informed of the latest as we are informed. Any further questions? No. Thank you very much. Thank you.